So my name is Aradhana, but I usually go by Ara, which I soon learned that it meant no in Georgian. So when I first came here, I kept hearing no. Something a little bit about me is I have a bachelor's in public health and psychology and a master's also in public health with a concentration in disease prevention and health promotion. I currently work at NYU University at the Center of Drug Use and HIV Research. So I currently work at NYU University as a junior research scientist. I work on a research project which looks at HIV adherence in terms of treatment and medication adherence in individuals who are diagnosed with HIV and AIDS. 3 words that would describe me is driven. The second one, even though it's not one word, first generation immigrant. My family and I first moved to America and we're the first family in our entire ancestry, so that's why I call myself first generation immigrant. And the third one would be focused. I was always naturally interested by the brain, so I wanted to pursue a medical degree, but when I started my undergraduate education, I started working under my research mentor on a research project that dealt with functional connectivity and in cocaine addicts. So I wanted a degree that would bridge public health and the clinical field, and which is why I majored in Bachelor's of Public Health and Psychology. So that's the reason that I majored in Bachelor's of Public Health and Psychology, and I felt that it was a perfect fit because it bridged the clinical field and also the public health field, and it allowed me to look at public health issues such as substance abuse and HIV from a community perspective rather than an individual perspective, which is why I chose that major. How I learned about CIF is through my master's advisor. She actually sent it to me and said, since you're working on HIV research, this is something that you might be interested in, so which is why I applied to the internship. But in general, I knew about CIF because I followed their Twitter account, and I always saw all the different collaborations that they did with international foundations and their mission of solving health issues on a global scale is which further intrigued me in this internship. Because I worked with HIV individuals in New York City, I wanted to see how the Georgian population in terms of HIV use and substance use differed in this kind of setting compared to a country like USA. As I was starting this internship, I soon found out that Georgia is a low HIV prevalence country, but yet it's still an ongoing issue because of the substance use that is an issue and is continuing on a growing basis, which is why I wanted to do this internship, and that was also my goal. I feel as a researcher, in order to be a well-equipped researcher, it's important for you to understand different public health issues on a global perspective. So if you work just in New York, I don't think that makes you a good researcher. You need to know how the diseases play out and what kind of treatments offered in different countries, which will help different countries learn from each other in terms of what prevention programs, what harm reduction programs will help them. I worked on data that looked at utilization of prevention programs in relation to HIV risk behavior. So this data was already analyzed, and my role I was here for 2 weeks, so during the first week, I was in charge of doing literature search to see what other countries and what other areas looked at how HIV individuals used the programs that was offered and if it helped them reduce their HIV risk behavior. So I had to see if it was done, and if it was done, what they did and what the results were. And during my second week, I was in charge of collaborating for writing a paper. So I had to write the introduction of a paper which we plan on submitting, disseminating the information that we found from the surveys conducted. So I actually plan on going back to school for a PhD in clinical psychology. Hopefully I will start next year. I will be applying at the end of this year in December. And with this degree, I hope to combine the clinical field and the research field like I mentioned earlier, and hopefully give me a better background in helping individuals in a research setting, but also with that clinical experience, it'll help me understand how those patients are feeling and their actions and how different programs may interact with their behavior and their emotions and so on and so forth. I also want to thank SIF for giving me this opportunity and for me allowing to be in Georgia and hosting me. I've had a really awesome experience working with many women, which is mostly women in this office, who are working towards a big public health issue and they're in the forefront of solving it in Georgia. It helped me grow professionally and also personally, so I just want to thank everyone.